children, especially those who are just born, that's 1 day, up to age 5, are very delicate and always have a low immunity and are easily affected by common infections within our communities. And they need prompt management of the relevant illnesses identified with them as soon as possible to avoid them from getting severity or complications of the illnesses, and also to avoid mortalities in young children. And in this video, we shall talk about the 6 common danger signs observed in a child when having a severe illness. And they include the following. Number 1, poor feeding. This is the commonest and the earliest sign observed in a child who is having an illness. A child may, 1, lose appetite, can refuse to eat. For a baby, may refuse to suckle. Others may suckle less or may eat less than they eat normally. Others may lose taste of whatever they are eating. Others can fail and can totally fail to respond to it, or fail to respond to suckle. And others, especially those who have 5 years or 4 years who can speak, will tell you, I don't want food. This is an observable sign by especially the mothers or the primary caregivers of the children. And once identified, the cause as to why the appetite has been lost should be screened as soon as possible and identified. Number 2 is lethargy. This is what we call excessively being weak or excessively being discomfort, and sometimes loss or an inability to respond to stimuli. And most times lethargy always interacts with poor feeding, because most lethargic children most of the time have low appetite, they have low blood sugars, they are dehydrated, and hence they have discomfort and respond less to the stimuli. For example, a child may be called by the name and might fail to look at you. A child may be tapped but can fail to respond, or may be pinched but might fail to respond to pain when situation worsens. Number 3, abnormal temperature. This is one of the commonest symptoms always identified by anybody. And in a sick child, a temperature might be excessively high, very hot, and this is in people who are having febrile illnesses like malaria, flu, cough, and others. At any temperature which is above 37.5 degrees centigrade is an abnormally high temperature. And in this case, when identified, a parent should take the child to the hospital as soon as possible. And also, abnormally low body temperature. Temperature readings of 35.5 degrees centigrade and below is a warning sign that the child is not doing well. In case it's a bacterial infection, you might find that sepsis has set in and the child's health is really deteriorating. So all extremes of temperature, either too high or too low, are a danger signs in children. And number 4 is convulsions. In children who tend to get very febrile, most times tend to get convulsions. And this is observed as a patient losing consciousness and fitting in most times, jerking the body, the eyes rolling, sometimes incontinence. But however, in some children, especially the babies, some of them might not fully lose consciousness. You might find a few of them having a small part of the body, e.g. the hand jerking alone, the legs jerking alone, or the eyes closing speed. And sometimes you might find a young baby screaming too much non-stop. It might be a sign that a child is getting a convulsion. And remember, a convulsion is not a diagnosis, but it's a sign showing that something is wrong in the body of the child and medical attention should be sought immediately. And number 5, respiratory distress. Children of a low age, especially those ones who are having respiratory tract infections, tend to get challenges in their breath or in their breathing style, especially when they have acute or chronic respiratory tract infection. And therefore, certain signs and symptoms must be observed when your child is breathing badly. For example, fast breathing. Number 2, a wheezing sound when breathing. We tend to hear the sound of in young children who are having cough or flu or other respiratory distresses. And sometimes a stridor. Those abnormal sounds heard in the chest of a child are a warning that the child is not doing well. And lastly, we shall talk about the chest indrawing. Most babies, especially those who are having severe pneumonia, tend to get chest indrawing. Thereby you will have a look at the rib muscles near the diaphragm going inside as the child breathes in and out. That's a sign that the child is already having a lung or challenges in the breathing system and needs emergency health care within the hospital, necessitating IV medication and also oxygen in some cases or nebulization in some cases. Therefore, in case chest indrawing is observed in a child, whether at birth or a 1-year child or a few months child or a 5-year child, the child should be rushed to hospital immediately to save a life. And lastly, we shall talk about jaundice, commonly known as yellowing of the skin. This is a common phenomenon within children who are having problems in their body. For example, it's easily identified by yellowing of the white pigment of the eye, and when it progresses, you find the whole body turning yellow, or the palms turning yellow when you check, or below the foot turning yellow when you check. This sign, jaundice, when it is identified, can be managed in the hospital and the child becomes fine. But if we take long before taking these children to hospital, especially the neonates, they can end up getting complications. For example, cerebral palsy, which is a lifetime illness or disorder. Therefore, we urge all parents, in case you see any of the yellowing of the sign, or yellowing of the skin of the babies, or any of the above 6 danger signs identified, we urge you to visit a health facility, seek medical advice, seek medical attention and treatment for the children as soon as possible. Thank you, and see you in our next video. Bye-bye.